Okay, we are doing chapter 8. This chapter you should know a lot about, pretty much because we all have a reproductive system and we know our body parts. First, we're going to talk about our female reproductive system. Again, those first paragraphs are awesome. There are two main parts. You've got your ovaries that produce the eggs and the uterus that passes the male sperm through the tubes and carries the fetus. Underline those two statements. Ovaries produce the eggs and the uterus passes a male sperm through the tubes and carries the fetus. So what's the function of the uterus? To pass the male sperm through to the tubes and carry the fetus. The fertilization of eggs or conception occurs in the fallopian tubes. Where does the fertilization of eggs occur? The fallopian tubes. The anatomy of the female reproductive system. Y'all already know what these are. I'm sure we're all females. External organs, they do call it the labia majora, which is your larger lips. Your labia minora, which is your small lips. Your Bartholin's glands, that is located beside the opening of the vagina. And your clitoris, which meets at the two small lips. We're not going to go deep into any of that. You just need to know where they're at. Vagina, you know. Uterus, know that it is a hollow organ that carries the fetus. Ovaries, underline and star that the ovaries produce eggs and hormones. Ovaries produce eggs and hormones. And the fallopian tubes, they're tubes that serve as tunnels for egg cells. They are the tunnels that get the egg cells to your uterus. The menstrual cycle. Now, they do break down this, and you need to know all about your menstrual cycle, which takes an average of 28 days. The menstrual cycle includes your four major hormones: estrogen, progesterone, follicle-stimulating hormone, and luteinizing hormone. All of those are very important hormones that make our cycles what they are. So, we got your follicular phase, which is your first phase. Underline, star, it starts on the first day of the period. So the brain releases follicle-stimulating and luteinizing hormones that travel in the blood to the ovaries. It makes this happen. These hormones trigger an increased production of estrogen. Underline and star that. In the follicular phase, the luteinizing hormones trigger an increased production of estrogen. Underline and star it. And that again starts on your first day of your period. Follicular phase starts on your first day of your period. Then you move on to your ovulatory phase. It starts about 14 days after the follicular phase. So day 14. It is actually the midpoint of your menstrual cycle. Your period is probably already off. And now you got your ovulatory phase. This is more estrogen, and it releases the egg. That's what we need happening, and the cervix produces more thicker mucus on purpose so it can hold the baby. And so we can have that there. Then your luteal phase. This phase begins after ovulation. Once the follicle releases the egg, the follicle will develop into a corpus luteum. The corpus luteum secretes progesterone, which prepares the uterus to implant the fertilized egg. So we know that progesterone prepares the uterus to implant the fertilized egg. It's also known as the being pregnant phase. At this point, once the egg is implanted, we become pregnant. If the egg is not fertilized, it passes through the uterus as the uterus lining breaks and the period begins again. And we're going to call that the follicular phase. Follicular phase. So your follicular phase is first, then your ovulatory phase, then your luteal phase. Follicular is the first day of your period. Ovulatory is the 14th day of your period. Luteal phase begins right after your ovulation. You either get pregnant or you don't. If you don't, there goes your period. Starts all over again. Pregnancy. We're going to act like we done got pregnant. The average pregnancy lasts 40 weeks or 3 trimesters. You know your symptoms if you've ever had a child. Then breast changes, absence of periods, nausea, vomiting, mood swings, all kind of stuff, heartburn. Everything's going on. During your prenatal care, the doctors may use a pelvimeter to determine a female's pelvis in relation to the birth of the baby. They use a pelvimeter to make sure that your pelvis is large enough to have a baby. Most women's are, because we are women. That's the way our pelvis is made. Sometimes not. Sometimes during complications, we're going to have C-sections and all the above. But that's what they're going to use, a pelvimeter, just in the beginning. At 37 weeks, the baby is considered full term. It comes out the head down. Babies generally weigh about 6 to 9 pounds and 19 to 21 inches long. Underline and star that. Make sure that you know 6 to 9 pounds, 19 to 21 inches long. After giving birth, a woman experiences physical and emotional changes and therefore receive postpartum care. They want you to remember that as well. What is the meaning of postpartum care? It is care given after birth, when women experience physical and emotional changes. So, they're going to break down your pregnancy. Your first trimester is 1 to 12 weeks. Underline that. That's very important. That's everybody and everything is growing at that time. We've learned when things develop, especially your heart, circulatory system, arteries, veins. All that's developing, 1 to 12. Your second trimester is 13 to 28 weeks. And then your third trimester is 29 to 40 weeks. Everything's getting better and better. Your baby is almost there, getting fatter, getting viable. Just remember those weeks, especially your first trimester, 1 to 12 weeks. The male reproductive system. We also should know these body parts and be inspecting those body parts at all times. External organs, the penis. They have the root and the shaft, and the glands, which is the head. Some will have their foreskin removed, which is called circumcision. And they also have your urethra, just like a female, except for theirs comes out at the end of their penis. Then they have scrotum, which is a pouch-like sac that hangs below the penis, which contains your testicle, nerves, and blood vessels. And it hangs there on purpose so it can stay a little cooler. More heat actually kills sperm cells. Testicles, or testes, oval-shaped organs located inside the scrotum. Underline and star that one. What is a testes? It is an oval-shaped organ located inside the scrotum. And the main hormone there is testosterone. And of course, it is all responsible for sperm cell production. That's your outside. Your internal organs, you have the epididymis, which is a tube that attached to the testicles that transports, stores, and matures sperm. So that is where their sperm is being transported and maturing. The vas deferens, which is just a sperm duct, meaning that's where it comes from. Seminal vesicles, underline and star that. They're sac-like pouches that attach to the vas deferens, produce fructose to provide sperm for energy. So, underline and star that. Seminal vesicles produce fructose to supply or provide sperm with energy. So, it's in their ejaculatory fluid. Your prostate gland is there, located below the urinary bladder before the rectum. It contributes additional fluid to the ejaculate as well. And they also have the bulbourethral glands, copper glands. It neutralizes acid in the urethra, which helps the sperm go through without being killed by the urine that used to be in there. Sexually transmitted diseases. First one we're going to learn about is bacterial vaginosis. It's normal balance of bacteria in the vagina is disrupted. That's all it means is you've got a normal bacteria that you have, that is your own flora, that is your own. When that is disrupted, we get bacterial vaginosis. You'll notice a vaginal discharge. And again, if it's bacteria, what are we going to give? Antibiotics. Then we got chlamydia. Underline, it's caused by a bacteria called Chlamydia trachomatis. That's very important. It is a STD and it is a bacteria, so again, I give antibiotics. Gonorrhea. It's caused by a bacteria, Neisseria gonorrhea. Very common infectious disease, underline that. And what is caused by Neisseria gonorrhea. And What are we going to give? Antibiotics. Hepatitis, they are ABC. Sorry. Hepatitis A, underlined, and this is very important. They break down this hepatitis ABC. They really do. Hepatitis A, incubation period of about 28 days. It is fecal-oral route, and they're going to test it through your blood, which is your serologic testing, and they're going to give some kind of medications as well. Hepatitis B, underlined in star, 6 weeks and 6 months. That is the incubation period. That's how long it takes to grow. Of course, it comes from unprotected sex, but in bloody fluid sharing, it actually resolves on its own a lot of times. There's a vaccine for that. The health cares mostly are offered, so we won't get it. No medications are available to prevent hepatitis B from becoming a chronic condition. Fatigue, vomiting, dark urine, all that kind of stuff can mess you up. Hepatitis C, the incubation period is between 1 and 6 months. It's transmitted by any source of blood or bodily fluids. Treatment involves use of antiviral medications. Underline that. Hepatitis C, incubation period 1 to 6 months, transmitted by blood. They now have a shot called Harvoni that can help with hepatitis C. But hepatitis C, we're going to give antiviral medications. Herpes, underline in star, incubation period. That means their growth period is between 6 and 8 days. So once you've been exposed, you will have a breakout or have some kind of symptoms within 6 to 8 days. It's transmitted by direct skin or mucous membrane contact. You're going to feel fever, pain in the genital area, pain while urinating or genital discharge. They're going to swab the sores. They'll take a sample from the sore. And there is no cure for herpes, but they can give you antiviral medications that will treat the breakouts, make it not come out as much. But do you remember that for herpes, the incubation period is between 6 and 8 days. HIV. HIV is a virus that causes AIDS. HIV is what you have, and then it turns into AIDS when your white blood cell count goes too low. The incubation period varies on the individual. A lot of times they'll tell you up to 6 months. So if you've been thinking you've been exposed, you need to continue to check yourself up to 6 months. I think anytime you have sex, you've been exposed. So figure that one. A diagnosis for HIV. Diagnosis can be reached through an antibody test called the ELISA. E-L-I-S-A, the ELISA. That is the diagnosis for HIV, the ELISA test. Also, they might do a Western blot test. That is also for HIV. There's no cure for HIV, and they do give antiviral medications as well. Human papillomavirus. Most common STI, which is sexually transmitted infection. May say STD or STI nowadays. Sexually transmitted infection. Symptoms include genital warts and or cancer, sores. They're really worried about that now because the warts a lot of times turn into cancerous. They would do pap smears for our ladies. They also do pretty much a visual for a male. There's no cure for HPV, and they treat the symptoms such as the warts. So if they try to get them ahead of time before they are allowed to grow, then no bad signs come from that. Now we have a shot for that you have to be a certain age to get that shot though. But it's helping. The pelvic inflammatory disease. It is infection of the female reproductive system. It's a complication of STDs, such as gonorrhea and chlamydia. Pretty much is that it's grown so much and went into your pelvis area and has spread. That means it got bad. That you didn't get it treated, something happened, or it's just growing really super fast. You have vaginal discharge, painful intercourse, abdominal pain. You can check that on physical examination. Of course, we're going to give antibiotics, and a lot of them. Because once it gets there, it can get into your bloodstream and kill you. And that would be bad. To have to explain why you got killed by STD. Syphilis. underlining store that it is caused by Trichomonas or Trichomonas pallidum. Spell that word. Treponema, pallidum. Know that word. Know that it is what causes syphilis. The primary stage is small sores, then a rash comes along, and then no symptoms after that until it comes back head on and starts messing with everything you got, even down to your brain cells. Messes you up pretty bad. It's transmitted through sexual activity, but in the beginning, small sore, then a rash, and then nothing. So make sure, always just get a syphilis test just in case. And a lot of times they will do that, especially if you're pregnant. They'll do one just to make sure. An antibody test called the Wassermann test can also determine syphilis. Underline and star that. The Wassermann test determines syphilis. Then we got Trichomonas or Trichomoniasis. That is the fancy word for it. It's caused by a parasite, Trichomonas vaginalis. People get that often. It is often that people get it. Most of the time it's in the urethra or the vagina for women. Urethra for men. Of course, transmitted penis to vagina, vagina to vagina. It'll have an odorous vaginal discharge. A lot of times it actually smells worse than the others. Physical examination is performed to determine the condition, and of course we're going to treat it with some type of medication that kills parasites, because it is caused by the parasite Trichomonas vaginalis. And the most or common medical conditions for your reproductive system, of course, we have infertility. It's a biological inability to contribute to reproduction. That's the fancy word to say you can't get pregnant, you can't make babies. Biological inability to contribute to reproduction. Both male and female. Sometimes it does cause a psychological state, a problem for the affected person if they can't make babies. It hurts their feelings, it messes with their head. And sometimes they have to get treatments or actually counseling if they're infertile. Then we got impotence. It's a sexual dysfunction that characterizes itself in the inability to maintain an erection of the penis. What is an impotence? It's the inability to maintain an erection of the penis. Know those differences. Those are different ones, and people do get them confused. Infertility, can't make a baby. Impotence, you can't maintain erection. And that is Chapter 8 with your reproductive system.